number of problems in which you can, diseases in which you can get low urinary tract dysfunction. Probably the commonest group of patients that we have is what we call idiopathic overactive bladder. That sounds very a very verbose kind of a term, but what it means is we don't know why it happens. So it's an unexplained bladder irritability. We call it overactive bladder. So it's essentially a diagnosis of exclusion. So there's no other disease, no infection, no stone, no cancer, nothing. And then the person still complains of a bladder irritability. And the typical symptom there would be frequency, urgency, an urgent desire to rush to the toilet. And in its severest form, it can actually lead to an incontinence or leakage of urine into your clothes. So it's extremely distressing to the people that it happens. And although it's not life-threatening, it doesn't usually threaten the kidneys or kidney function, or in that sense, it's not a health hazard for most people, but it can be emotionally debilitating. Many of these patients can actually get very depressed, can withdraw from society, and might not do anything except sit next to the toilet door, waiting for the next urgency episode to happen. So for these people, really, this is a very good alternative. Now you ask, what are the other conditions in which it happens? So one common problem is overactive bladder. But then there are several other situations where you can get this kind of bladder dysfunction, primarily in neurological disease. So you can get it, for instance, in diseases like multiple sclerosis or spina bifida or spinal cord injuries or many other neurological conditions. You can also get it in other age-related problems. So, in patients with benign prostatic obstruction, prostate-related urinary tract obstruction, as a secondary change, you can get associated bladder problems, not necessarily secondary. You can get associated bladder problems where the bladder has this irritability and the patient has a strong sense of urgency. This happens in elderly women, especially. They tend to have incontinence. So it can affect any age group, but it tends to happen more often in people as we age. So the commonest group of patients in whom this is severe will be the elderly population, where a lot of incontinence episodes will be attributable to this kind of a bladder problem. Look younger. If you inject too much on your face loses expression, and then you look like an expressionless person. So the same thing when it's done in the bladder, when you inject in the right concentrations into the bladder muscle, you can reduce the bladder's irritability so that these symptoms go away in most situations without causing any systemic side effects elsewhere in the body. First time that this particular toxin was discovered was somewhere in the 1700s. So it was before 1800 AD that this toxin was first discovered. And that word botulinum that we tell you, this word actually is the German word for sausage. You know, sausages that we eat, typically in India we make them out of chicken, but you can have these sausages, these pork and bacon, pork sausages. The German word for that sausage is botul something. I don't remember the exact word for it, but so it was discovered in the 1780 or something as a cause for food poisoning. So botulinum is the toxin produced by a bacterium Clostridium botulinum, and that is the toxin which is a deadly toxin, as I said. It's very poisonous, causes food poisoning, especially with non-vegetarian food products which are not kept hygienically. So this was first identified somewhere in the late 1700s. It was used medically for the first time in the early 20th century, somewhere in the 1920s or 15 or 20. I think for strabismus people tried using it, if I remember correctly. For squint, yeah. The first urological use was in 1988, if I remember correctly, by Dijkstra for injection into the rectal sphincter. But really, it never caught on that way. So I think a large proportion of our understanding of the use of this drug, our ability to use it for overactive bladder, a condition that we did not have a definition for way back in those times, has happened in recent years. So there is an explosion of usage of botulinum toxin. We are now understanding better where we can use it, where we should not use it, what dosages to use. So over the last few years, I think there's a big explosion in its usage, and we are discovering more and more situations where we can actually benefit patients by the use of this drug. So there are side effects, as with anything else in life. There are side effects associated with botulinum toxin also. The main side effects that we that occur with botulinum toxin are urinary tract infection, because you're doing a procedure going through the urinary tract and injecting into the bladder. So urinary tract infection is the commonest side effect that you can get. In all patients, we take certain steps to try and reduce the odds of getting a urinary infection, but despite all this, it can still happen, and if it happens, we need to treat it. The second thing that can happen is once in a while the bladder, the patient might not be able to pass urine. This is not very common with the dosages that we use. This is important only with the idiopathic overactive bladder population by and large, because some patients with lower tract dysfunction are using other methods of emptying their bladder. So it happens in about 5% of people when you inject, and usually if it happens, it is not usually, it's invariably a transient problem. It's not a permanent problem, lasts for a few weeks typically. So if it happens in about 5% of people. Rare side effects like systemic side effects and all are extremely rare. So by and large, it's fairly well tolerated, and I think has been is fairly commonly used now abroad in the Western populations, including, I'm sure, in the United Kingdom.